Hi, my name is Sonny, and my presentation this morning is about perspective in psychology. Psychology as a discipline. Psychology can be defined as the study of behaviors and mental processes. It aims to understand individuals and groups by underlying psychological processes and mechanisms that influences their thoughts, feelings, and behavior. Some goals of psychology include understanding human behavior, improving mental health, promoting well being, and advancing knowledge. Psychological perspective is a set of ideas, values, and assumptions that guide the study and understanding of human behavior and mental processes. A psychological perspective has the following features: theoretical perspective, values and assumption, methodology, focus, and application. Behaviorism as a psychological perspective. Behaviorism, theoretical framework, holds that behavior is learned through interaction with the environment and not necessarily to understand the behavior. Values and assumption. Values scientific methods and empirical evidence. Methodology uses observational and experimental method to understand human behavior. Focus focuses on observable behavior such as learning and motivation. Application theories are applied to fields such as education, therapy, and industry to improve behavior and performance. Key assumption of behaviorism. John B. Watson, known as the founder of behaviorism, summarized the assumption of behavioral approach in 1913. He explained that psychology should focus observations and measurement rather than internal mental states. Our behavior are primarily shaped through interaction with the environment. Emotional response can be conditioned. Strengths and weaknesses of John B. Watson's assumption of behaviorism. Strengths: shifted psychology towards more objective, measurable methods, which help establish psychology as a scientific discipline, demonstrate that emotions and behaviors can be learned, influencing fields like advertising and education. Limitation: ignored internal mental processes, oversimplifying human behavior, underestimated the role of biology and innate predisposition. Key assumption of behaviorism. Ivan Pavlov, classical conditioning, discovered classical conditioning through experiments with dogs, showing that a neutral stimulus can elicit a conditioned response after pairing with an unconditional stimulus. Strengths and weaknesses of Ivan Pavlov's assumption of behaviorism. Strength: provided a clear, replicable experimental framework for studying learning. Applications in treating phobias, anxiety, and behavior modification. Limitation: research based on animals limiting direct generalizability to humans. Focused mainly on simple stimulus response association, neglecting cognitive and social factors. Key assumption of behaviorism. B.F. Skinner operant conditioning developed the theory of operant conditioning, emphasizing reinforcement and punishment as a key factor in shaping behavior. Created the Skinner box to study learning in animals. Strengths and weaknesses of B.F. Skinner assumption of behaviorism. Strengths: highly practical application in education, therapy, and behavior management. Example, token economics. Limitation: over-reliance on laboratory settings which may not reflect real-world complexity. Viewed humans as a passive recipients of environmental control, displaying free will and intrinsic motivation. Application of behaviorism in contemporary issues. Cognitive behavior therapy, CBT. CBT integrates behaviorist principle, operant and classic conditioning with cognitive psychology. Behavioral techniques such as exposure therapy, systematic desensitization, and behavioral activation stem directly from classic and operant conditioning. Application of contemporary issues. Application to contemporary issues. Anxiety disorder. Exposure therapy reduces avoidance behaviors through extinction. Depression. Behavioral activation uses reinforcement principles to increase engagement in rewarding activities. Strengths and weaknesses of behaviorism application in CBT. Strength. CBT has strong empirical support for a range of disorders, including depression, anxiety, PTSD, post-traumatic stress disorder, and OCD. Allows progress tracking through observable behavior changes. Weaknesses. Addresses behavioral symptoms without fully resolving underlying causes. Not always suitable for individuals with severe cognitive impairment or low motivation. Application of behaviorism in contemporary issues. Behavior modification, token economics, and operant conditioning. Direct application of scanner operant conditioning. Desired behaviors are reinforced, e.g. with token, and undesired behaviors are discouraged via extinction or mild punishment. Application of contemporary issue. Education. Token system used for classroom behavior management. Clinical setting. Used in psychiatric wards or for individuals with developmental disorders to reinforce self-care, social, or occupational skills. Strengths and weaknesses of behaviorism application in behavior modification. Strengths. Immediate feedback and reinforcement makes learning effective. Adaptive to different settings, schools, therapy, prisons, and hospitals. Weaknesses. Behavior may deteriorate if reinforcement is removed, maintenance problem. Risk of over-controlling individuals, potentially reducing autonomy. Humanism as a psychological perspective. Humanism. Theoretical framework holds that individuals have the capacity for self-directed growth and that the environment plays a crucial role in shaping behavior. Values and assumption. Values individual freedom, dignity, and self-actualization. Methodology. Use methods such as client-centered therapy, which emphasizes the importance of the therapeutic relationship and the individual's subjective experience. Focus. Focuses on the whole person, including their thoughts, feelings, and behavior. Application. Theories are applied to fields such as psychotherapy, education, and counseling to promote personal growth and well-being. Key assumption of humanism. Carl Rogers' person-centered approach developed Client-centered therapy, also known as person-centered therapy, emphasizing empathy, unconditional positive regard, and congress from the therapist. Believed in the actualization tendency, the innate drive for individual to grow, improve, and fulfill potentials. Strength and weaknesses of Carl Rogers' assumption of humanism. Strength: revolutionize psychotherapy by focusing on the therapeutic relationship rather than the therapist's authority. Has the empirical support that shows that empathy and unconditional positive regard contribute to therapy success across modalities. Limitation: lacks a strong scientific framework. Many concepts, example, self-actualization, are difficult to measure objectively. Overemphasizes on conscious experience, neglecting unconscious influences and biological factors. Key assumption of humanism. Abraham Maslow, hierarchy of needs, proposed the hierarchy of needs model, suggesting that basic psychological and safety needs must be met before higher needs like love, esteem, and self-actualization can be pursued. Strength and weaknesses of Abraham Maslow's assumption of humanism. Strength: encourage a shift from pathology-focused psychology to studying positive aspects of human nature. Limitation: lacks empirical universality. Research suggests people can pursue higher needs even without all lower needs are met. Key assumption of humanism. Rolla May, existential humanistic perspective. Integrated existential philosophy with humanistic psychology, focusing on meaning, choice, and responsibility. Stressed the importance of facing anxiety as a catalyst for personal growth. Strength and weaknesses of Rolla May assumption of humanism. Strength: addresses deeper existential concern often overlooked by other approaches. Recognizes the role of anxiety as a normal part of human existence rather than a symptom to be eliminated. Limitation: less structured for empirical testing. Can be too abstract for individuals seeking concrete step-by-step intervention. Application for humanism in contemporary issues. Person-centered therapy. PCT is based on the belief that people have the capacity for self-understanding and self-improvement if provided with the right condition, empathy, unconditional positive regard, and congress. Strength and weaknesses of humanism application in PCT. Strength: studies show that a strong therapeutic alliance predicts positive outcomes across different therapy types, encourages self-awareness, autonomy, and personal growth. Weaknesses: some clients may require more directive techniques, especially in crisis situations. May be less effective for several mental disorders such as schizophrenia. Application of humanism in contemporary issues. Humanistic approaches in education. Applies principle of self-actualization, student autonomy, and intrinsic motivation to learning environment. Teachers act as facilitators, focusing on students' needs, creativity, and personal growth rather than rote memorization. Application for contemporary issues. Students' well-being promotes emotional and self-development alongside academic achievement. Strengths and weaknesses of humanism application in education. Strengths: enhances motivation by using students' interests and autonomy. Learning becomes more meaningful. Focuses on emotional, creative, and social growth in addition to academics. Weaknesses: personalized education requires more teacher involvement and planning. May prioritize personal growth over meeting curriculum standards. Similarities between behaviorism and humanism. Both focuses on the individual as a unit of study. Both lay an emphasis on environmental influences. Both share a common perspective on developmental focuses. Development focus. Evaluation on application of behaviorism and humanism to contemporary issues. Behaviorism applies principle of reinforcement to direct observable behavior. For instance, students earn tokens for positive behavior that can later be exchanged for rewards. Some strengths include: produces measurable and observable results, effective for establishing clear routines and reducing disruptive behaviors, provides immediate feedback to learners. Some weaknesses include: ignores internal mental processes, risks of over-reliance on external rewards, limited applicability to complex human experience. Humanism in practice, person-centered therapy in mental health. Humanism has its focus on self-actualization, empathy, and personal growth. Empower the individual, fosters a strong therapeutic relationship, holistic and person focus. Weaknesses: lacks structure and measurable outcomes, less effective for crisis on several pathology, highly dependent on therapist skill and client readiness. Difference between behaviorism and humanism. Focuses on observable behavior of the individuals. Methodology: relies on quantitative empirical methods such as experimentation and observation. Goals: aims to improve behavior, mental processes through external interventions such as reinforcement and punishment. Emphasis: emphasizes on the role of environment in shaping behavior. Ethics: values ethics as a matter of external reinforcement and punishment. Humanism: focuses on the individual as a whole, including their thoughts, feelings, and experience. Employs a more qualitative, subjective approach such as phenomenology and introspections. Aims to promote personal growth and self-actualization and well-being. Emphasizes the role of internal processes such as thoughts, feelings, and experience. Values ethics as a matter of personal values and principles. Key assumptions.